There's one group specifically that we've ignored in the cardiovascular world, and that really is women.
Welcome back to another Beating the Odds Conference Conversations. I'm Marc with HeartLife. We are here with the amazing Dr. Martha Gulati. Thank you so much for being here today.
Thanks for having me.
Can you just tell us a little bit about what you do, where you're from?
Well, I'm a preventive cardiologist, and I was at Cedars-Sinai as the associate director of the Barbra Streisand Women's Heart Center, but I'm literally moving to Houston, Texas, where I will be the director of the new Davis Women's Heart Center.
Amazing. Congratulations on the move.
Yes, thank you. And I can throw out that I'm also Canadian. I don't know that this is a Canadian group or international, but I was adopted by Canadians. I am born and bred in the great country where the Blue Jays are from.
Okay, so taking on this director role, specifically in women's health, why women's health and cardiovascular disease?
Well, I think, the most important thing is for us to keep figuring out solutions to improve health. And there's one group specifically that we've ignored in the cardiovascular world, and that really is women. I mean, we've done all our research really in men. We treat men more aggressively than women, and there's a lot of bias in our care. And that bias is also based on the fact that we haven't studied women. So when I was doing medical school, I actually realized we had no research on women and that I wanted to be part of that solution. And I'm very lucky to have thought of that in medical school and then been able to create my career in a way that I've been able to try to contribute in some way to the problems that we have. For 51% of the population,
Yeah.
we really need to do better.
And so how can patient advocacy groups support our healthcare professionals in doing better? How can we work together?
Well, I think patient advocacy groups have such an important role because they bring to light what the patient is experiencing and what they go through and how they eventually, whether they get to their diagnosis or whether they get to the right doctors, whatever it is that they need, how does that happen? And I think that the patient's voice has never been more important as well. Right now, I think medicine, we've become less paternalistic, I hope, and more where we're doing shared decision making. If anyone has missed my silly video that I posted today on Twitter, it was all about shared decision making. And I think that working together with patients and patients always reminding us that they're the center of healthcare. It's not about us. It's not about the healthcare team. It's about our patients. And we just get the privilege of surrounding ourselves around them and hopefully getting them to the right place.
Amazing. Dr. Gulati, thank you so much for your time. We really appreciate it. We really appreciate the work you do for being patients at the center of everything you do. Thank you.